Dr. Michael Mitchell with Mitchell Dental is back with us today. Dental health is so important, so I'm glad you're covering a lot of these topics that people probably don't take the time to read about until it's too late or call and ask.
Correct.
So today we're talking about the aging mouth, and what do you mean by that? What do you
First of all, the fastest growing segment of our population are seniors, and because people have done a good job keeping their teeth, as we get older, there are a unique set of problems that develop in our mouths. A lot of it's due to decrease in saliva flow. And as we get older, the salivary glands produce less saliva, but then also with medications, many of the medications that we take will also decrease saliva, and that puts us at risk for different types of dental disease.
Mm-hmm. You often think about, when you think about the older population, grandma and grandpa having dentures.
Right. Yeah, not so much anymore.
I would say that's something that's more avoidable now, though, right?
Correct. And our concerns as we get older, because of the decrease in saliva, is an increase in gum disease and also an increase of decay, particularly at and below the gum line. And there's an interesting study that was just released by the American Dental Association that found that about 43% of the population, adult population, that doesn't see a dentist regularly, doesn't do so because they feel like they don't have a perception that they have a problem going on. Mm-hmm. But many times these areas, especially that develop in seniors, where you're developing decay at or below the gum line or gum disease, are painful when they first start. So it's important that they're diagnosed early. The earlier they're diagnosed, the easier they're treated, and the less expensive it is to treat. So that's why we like to see seniors stay on with regular checkups and catching problems early.
So these problems are detectable if they go in every 6 months?
Sure.
As we're supposed to?
Sure. And then there are other things like prescription fluorides that can help reduce the risk of the gum line or root surface decay, and there are certain rinses and over-the-counter products that could be used also to help with salivary flow and decrease the risk of these disease processes that we were talking about.
So plenty of things people can do at home. Do they just give you a call if they have a concern, or?
Certainly. We can answer questions over the phone. We also have our website and our Facebook page also address many of these issues. A lot of interesting facts on Facebook. So we always invite people to visit us there, or to schedule an appointment, and certainly can detect a problem with it through an exam. One other thing I was going to point out that's available now, those that do have dentures, many of them have problems retaining a denture. Dry mouth also complicates the ability to retain a denture. And so now with implant systems, in particular, these smaller implants, which are called mini implants or narrow body implants, are very simple to place and can allow the attachment and retention of the denture and make wearing the denture much more comfortable. Our Topeka number is 273-0801. We have offices in Topeka on Wanamaker Drive, and we also have a Silver Lake office.
Lots of ways to find you. Dr. Mitchell, thank you.
Thank you.